Good morning, everybody. This is Wayne Gillis, CEO of RMCHCS, and I'm here for the monthly update for May. I'm excited to share with you what we discussed at the board level and just overall some of the things that are happening around the organization. So kind of for our topics today or our agenda, we've got debt reduction update. We've also got bright ideas and the update on kind of where that's at in progress, our operational key performance indicators and where that is at from a progression within the organization, community update, operational changes that we've made, some successes to date, capital equipment that we've purchased, and also recruitment update related to providers. So the first thing we want to kind of cover is where the debt reduction is. And so I want to kind of put this up for everybody. We are at zero, no more old debt, which is super, super exciting. Do want to remind everybody when we think about, the organization and with all the challenge that we've had for, years, one of the things that has gotten kind of waylaid, if you will, would be some of the infrastructure stuff, and y'all are experiencing that. And so we have, when we think about the facility and equipment needs that we still kind of have over and above the capital I'm going to talk about today, we have about $8.2 million that we need to phase in over time. We've been adding chillers and some of the HVAC systems, and we've got, sewage piping, we've got, some leaks that happen in the pharmacy, et cetera. So there's needs that are kind of across the organization that we're going to need to address. And that cumulative total is about 8.2 million. And so we'll start chipping away at that. Not all debt, but it's just needs in the organization that we need to plan for. So bright ideas, we've done, we're doing the process of train the trainers for the first kickoff is in June, so this month. And what the goal is that we'll have the bright ideas trained with every single department by the end of this month, and that is our target to have that done. When we start to talk about the operational KPIs and really putting those into practice, and I had shared with y'all at the forums that we're kind of rolling this out and probably do 2 groups at a time. And who I had shared that was going to be the first 2 groups was the OR perioperative space as well as the revenue cycle space. And so the education in those 2 departments has been completed. So what happens now for the second part of that is for us to sit down and actually work through with those groups to come up with what they want to measure from a key performance indicator and how that is going to benchmark nationally. And so that is all going to be happening this month. Once we get them kicked off, which will probably take a few weeks, we will end up then starting to transition to the next 2 departments that we will start to roll that out. When we think about this kind of the, progress and the kind of snapshot of our actual progress, we've had a number of areas that we have moved the needle. One has been swing bed. And we had talked about that at the forums and on the big impact that it has for us related to having a swing bed census. There's an opportunity for us of about $1.5 million if we can keep a census between 4 and 5. And so us really starting to develop that referral stream for us for outside of things that are admitted in the ED or admitted through, a procedural department. In order for us to get to that number, we're going to have to grow that. And so, for us really starting to market our kind of local clinical partners, when we think about some of the other hospitals that are kind of in our catchment area, we want to make sure that they understand that we can get referrals related to swing beds. And so that is in process right now. When we think about, our occupied appointments related to the clinic space, that's another opportunity that we've been working on. So we know we have, some significant demand, and we're trying to better manage that demand so that we can get people in as quickly as possible who need to see one of our providers. And so one of the creative things that the clinic team under Amanda's direction is that we have separated kind of the front desk admitting piece with the actual scheduling and answering the phone. And so we've segregated that off in those two teams and had that split. And so it's only been a few weeks, but we're already seeing some positive feedback from that. And so just like everything, as we think and see a problem within the organization, really the goal for us is to try to figure out how do we solution it? How do we make that better? How can we problem solve and improve that? Knowing that, even when we come up with a solution, sometimes it's not perfect, right? And that's okay. What we want to do is have the ability to be able to look and measure it to see, is it actually producing the result, the desired result that we wanted? And if not, we go back and relook at it and we see how do we need to tweak it going forward. Second thing I want to talk about is a community update. And we had the Development Authority, that was Development Authority Week, happened to be the same week as Hospital Week, but was able to go over and really talk about the future of the workforce and the challenges that we're having and critical access hospitals across the country. And so that was held at the University of New Mexico across the street. Had some great engagement, and we got to really kind of talk and share kind of really where some of the challenges that we currently have and what do we think is going to be happening in the future. The second thing is really working with New Mexico Department of Health and really working for the region for us to look at how do we continue to promote health from a tribal outreach as one segment, but also just globally within our community. When we think about the hospital and how we used to think of ourselves as a single encapsulated ecosystem, that has changed dramatically. Patients now are going and getting discharged much quicker than they used to 20 years ago. And so as we think about healthcare has to reach into the community. And so as we think about how do we deliver healthcare, we have to partner with education, with community, with churches, with local chambers of commerce. We've got to make sure we've got the right education when we think about students and coming, and that people are being trained for healthcare professions. And so we have to think of how we look at healthcare in a more global sense in order for us to really meet the needs of the community. And so that is a shift for us that we're starting to shift, far from perfect at it, but we are moving in that direction. I think we're making some great strides. Operational side, Dr. York is not going to be renewing his contract. And so from the standpoint of us transitioning his patients, he's working with Dr. Monroe and Dr. Bradford so that we can make sure none of our orthopedic patients fall through the cracks. Dr. Rodriguez has, left the organization, and he is, looking to go into private practice. And so we're, very supportive and, excited for his kind of next adventure. And then when we think about supply chain, we've actually brought some experts in for an assessment for us to figure out. We knew we had some opportunities related to how do we make sure we have the right supplies at the right place at the right time. And so we're going to be doing some refining in that space. And, over the next weeks or probably months, no more than 2, you should start seeing some improvement in that space. And we are excited about the output that's going to happen and what benefit that's going to bring to all of you who are end users. Some successes to date. When we think about first available appointment, and that's very important to us, we're staying from any provider, we're at less than 25 days. And that's super important. When Dr. Andrade leaves in July, it may go up a little bit, but we're trying to make sure we've backfilled that so we can mitigate any chances for that to kind of climb too much. Our wireless upgrade is 90% done. So that is exciting for us because the new routers are faster and have a lot bigger bandwidth. And so you should start seeing some improvement when we think about accessibility with some of the wireless tools that y'all are using from the clinical perspective. New external website is up, as well as the intranet is now up. We did hit our goal for the first time having a census in swing of 5 patients. It's not the case this week. This week's census overall is low, but a few weeks ago, last month in May, we did hit that. So that was exciting to hit that for like 2 days. And then when we think about capital equipment for next, we've got sleep lab equipment that we purchased. So that was for $35,000. It's going to take a little bit of time. We've got to work with Neon Coating, the vendor, in order for them to help us install that and get that set up so we can get that fully rocking and rolling. We had a new probe ultrasound for urology. Our sterilizers needed some updating, so we ended up accomplishing that. We've got our boilers, tank, and a pump that we had to replace in the facility side. We have also SCDs we've been working on since we've had a bigger need. We think about DVT prophylaxis and what that needs to look like, how often we need to use that, and the big benefits that it has for our patients. We're adding to that actual inventory. We did not have enough of those, and so that is going to be coming soon. Monitors for cardiac monitoring. When we think about our actual monitors in the ED, the OR, and PACU, we had some very, very, very old monitors in all of those spaces that were very limited on what we actually could do from pressures, etc. And so $350,000 was invested in order for us to be able to purchase new ones for all those spaces. So that has been ordered. And then we've got some new chillers that are being installed. So that should help us stay nice and cool for the summer. On the physician recruitment side, we had Dr. Chaco, who was a urologist candidate. He was here on the 16th of May, had a great visit. I think that was very positive. We've got Dr. Covalenti, who's a cardiologist. He's actually on site today, June 2nd. And, looking forward to getting his feedback. Cardiology, of course, we all know is a humongous need for us. It's probably our biggest gap related to being able to admit some of those cardiology patients to our floor because we need that cardiology support. We've got Dr. Broker, who's a general surgery candidate, and she is coming in a week. Dr. Decker is a family medicine. The site visit for that is June 17th. And then we've also got to Shayanoka is a psychiatrist, and he is coming next week as well for a second interview. So a lot of activity on the physician front, super excited about that. We've been really active with providers, being able to interview them. And so the pipeline nationally is pretty limited. And so for us to have this big of a list is pretty exciting. So that's all I have for the update today. I look forward to seeing everybody in the forums, and I hope you're having a great day. Talk to you soon.